Chapter 14, Part 2, Psychoanalytic Therapy, Sigmund Freud and Psychoanalysis. Psychoanalysis is a type of psychotherapy originated by Sigmund Freud, in which free association, dream interpretation, and analysis of resistance and transference are used to explore repressed or unconscious impulses, anxieties, and internal conflicts. Sigmund Freud originally developed psychoanalysis in the early 1900s. Its assumptions and techniques continue to influence many psychotherapies today. Psychoanalysis uses techniques designed to help unearth repressed memories of unresolved conflicts and frustrated urges so that the patient attains insight as to the real source of his or her problems. Free association is a technique in which the patient spontaneously reports all thoughts, feelings, and mental images as they come to mind, as a way of revealing unconscious thoughts and emotions. Resistance is the patient's unconscious attempts to block the revelation of repressed memories and conflicts. Dream interpretation is a technique in which the content of dreams is analyzed for disguised or symbolic wishes, meanings, and motivations. Interpretation is a technique in which the psychoanalyst offers a carefully timed explanation of the unconscious meaning of the patient's behavior, thoughts, feelings, or dreams. The psychoanalyst encourages transference, the process by which emotions and desires originally associated with a significant person in the patient's life, such as a parent, are unconsciously transferred to the psychoanalyst. All these psychoanalytic techniques are designed to help the patient achieve insight into how past conflicts influence his or her current behavior and relationships, and then place maladaptive behavior patterns with adaptive ones. On average, the traditional psychoanalyst sees the patient 4 or 5 times a week over the course of 4 years or longer. Short-term dynamic therapies. Many different forms of short-term dynamic therapies based on traditional psychoanalytic ideas are now available. The short-term dynamic therapies have several features in common. Therapeutic contact lasts no more than a few months. The patient's problems are quickly assessed at the beginning of therapy. The therapist and patient agree on specific, concrete, and attainable goals. In actual sessions, most therapists are more directive than traditional psychoanalysts. The therapist uses interpretations to help the patient recognize hidden feelings and transferences that may be occurring in important relationships in his or her life. Interpersonal therapy, IPT, a particularly influential short-term psychodynamic therapy, focuses on current relationships and social interactions and is highly structured. It is based on the assumption that psychological symptoms are caused and maintained by interpersonal problems. The therapist helps the person identify and understand his particular interpersonal problem and develop strategies to resolve it. In the IPT therapy model, there are 4 categories of personal problems: unresolved grief, role disputes, role transitions, and interpersonal deficits. IPT is used to treat depression, eating disorders, and substance abuse. In addition, it is used to help people deal with interpersonal problems, such as marital conflict, parenting issues, and conflicts at work.